This is Tyler. Tyler, in an heroic effort to put his bike together, wound up with sustaining a laceration of his right lateral thigh. What we're going to do for Tyler is put him back together here. You can tell by looking at the laceration that we've already anesthetized him with lidocaine with epi. You can see it's all blanched very nicely. I'm going to keep it nice and moist for him. And we've already irrigated it out. So Tyler's got a nice clean wound that we're going to suture. And what we're going to do with Tyler is we're going to suture him with a running horizontal mattress suture. And the nice thing about this is you can go very quickly with it, and it leaves a really nice scar because what it does is averts the skin edges. So it leaves a very, very strong laceration repair, as well as leaving a very good looking laceration repair, which is important for Tyler because he's anticipating a career in movies and he doesn't want to have any scars on his legs. He figures he'll put his own on there when he gets his tattoos, correct? Mm-hmm. Alright. The first stitch you're going to put on is going to be just a simple stitch to get things started down at the end here. Alright, and what we're using is a 3/0 nylon suture on him. And just simple garden variety tie is what we're going to do. And that just gets us started. So we've got the thing anchored, and then what we're going to do is get rid of the tail, and then we can start running it. And the big advantage of running sutures in these guys is that you don't wind up having to stop to tie the knots. And the big advantage of a horizontal mattress is that you can avert the wound edges, which is really what's most important when you look at these things. Alright, so what you do is you come in on the one side and then just go same side, come back out, and the other side. Now, Tyler was nice enough to give us a very, very straight laceration to work with. Other people aren't quite so nice, and in those instances you're really stuck dealing with a curve laceration, and in those it's absolutely no problem. You can suture around the curve, you can suture stellate lacerations. If it's stellate, what generally happens is you wind up having to interrupt it at some point. But if it's just a nice simple curve, you can just go ahead and do it the same way we're doing it here. You can see, pretty straightforward how we do this. And the nice thing about it is you'll see as we're pulling it a little bit tight, what will happen is the wound edges are averting. See how they avert? And that gives you a really nice strong repair. We're coming down the home stretch here, Tyler. You should be able to ride your bike with no problem, assuming you can get it out of the box. He did this while I was trying to get it out of the box. Alright, probably one more and you'll be done, dude. And then when you get to the end, it's fairly straightforward. You just close it like you would any other. So the second to the last stitch, leave yourself a tail. And then what you're going to do is come in here. And pull that up. Take a look at it. Make sure there's nothing we want to change. Looks pretty good for Tyler. Tyler, I think you'll be able to do close-ups in the movies with this with absolutely no problem. And then you just tie it.
NB 51304.
I'm putting a fair amount of knots in here, not because you need it for strength, but whoever the person is who's going to take these stitches out, it makes it easier for them to grab onto something like that. Alright, Tyler, your laceration is done. All right, and you are ready for a close-up. Thank you, Tyler, for lending us your leg.
No problem.